Good morning, sir.
Morning, morning. How are you?
Fine, sir. How are you?
Fine. Good, thanks. Thank you for. Do you have a copy of my slides, or how can I present them?
Sir, Dr. James Norberger, this is for the principal. Yeah, good morning.
Morning, sir.
Yeah, doctor, we do have your PPT with us, PowerPoint with us.
Excellent.
I can ask our technical expert to present the same.
That would be super.
And,
It's probably a lot easier
okay,
than me trying, if that's all right.
yeah, then when it is needed to change the slides, you can of course tell, then our technical expert will do that.
That would be grand. Thank you very much. And
Yeah,
thank
okay.
you for the invitation.
Yeah.
We are born with the ability to change someone's life. Don't waste it. Don't think of organ donation and transplantation as giving up part of yourself to keep a total stranger alive. It's really a total stranger giving up almost all of themselves to keep part of you alive. Be a symbol of hope for those who are waiting. Warm greetings to all. Organ donation is to donate our organs by our will to people who are in need. The objective of this webinar is to make us aware of the importance of organ donation and transplantation. If your actions inspire others to dream more, learn more, do more, and become more, you are a leader. On this event, I invite our principal, Reverend Father Dr. Jojo James in the Parable, to welcome the gathering.
Dear and most distinguished Dr. James Neuberger, dear participants of this international webinar, a very warm good morning to all. I'm highly honored today to witness this international webinar on organ donation and transplantation arranged by the IQAC Science College. First of all, I congratulate the IQAC for arranging such a wonderful and informative webinar for us today. We have, of course, generally heard about organ donation, let's say kidney transplantation and so on. We all might have read or heard a news that a 46-year-old man who was declared brain dead after meeting with an accident on September 24 last year saved several lives with organ donation. PM Suresh of our own district, Idukki, a head load worker, had been undergoing treatment at the Rajgiri hospital after he suffered, serious injuries to his head following a fall at his workplace at Wantan Maid. Suresh's wife, Bindu Suresh, and children, Ajish, Vinish, and Veena, they expressed their wish and donated his to eyes, liver, and kidneys. We have Mrida Sanjeevani, a Kerala government initiative, and a Kerala networking for organ donation functioning in our state. You also might have heard about Kidney Foundation and the charitable works of people like Reverend Father Davis Chiramel and Mr. Kochau Septinapalli, etc. in this regard. And today, we are going to know more about organ donation and transplantation with its ethical nuances from the mouth of an expert in this field. And we are immensely privileged to have Dr. James Neuberger with us today to share his views and experiences in this field. Dr. James Neuberger was educated at Westminster School and Christ Church, Oxford. After completing his medical training, he first worked as a junior doctor in London and Leeds, before moving back to London, where he worked for 10 years at the Institute of Liver Studies, King's College Hospital, London. Dr. Neuberger then went to the liver unit in Birmingham, where he was a consultant physician and honorary professor of medicine in the University of Birmingham. Dr. Neuberger was also the medical director for organ donation and transplantation for NHS Blood and Transplant, the NHS organization that manages, organ donation and transplantation in the UK. I was very much interested to know also that Dr. Neuberger is a good academician too. He has published, over 300 papers and edited 5 books on liver disease and transplantation. He has been an editor of the journal Transplantation for 10 years. He chaired the National Advisory Group, SABTO, that advises the United Kingdom ministers for UK ministers of health on the safety of organs, blood, tissues, and gametes for transplantation. He has worked even extensively with donation organizations, transplant units in many countries, including India, Pakistan, China, US, and many European countries. So besides this academic and professional qualification, I would like to add that He is a man of great personality and a very simple and humble in dealing. As you all know, in the UK, it is now early morning. That is time around 5:30 a.m. And in this early morning of the day, he is with us, being ready to interact with us with his knowledge and expertise. How enthusiastic he is, how benevolent he is. That itself is self-explanatory on what type of person he is with his duties, responsibilities, and in humanness. Dear Dr. Neuberger, we are extremely happy that you are here with us today, and thank you very much for consenting to give a lecture on organ donation and transplantation. On behalf of the management, staff, and students of Sancha College, and also staff and students and all the participants from other colleges, I extend a warm and cordial welcome to you, dear Dr. Neuberger.
Well,
I also welcome all the participants, staff, students of different colleges, and of course of Sancha College as well. Hearty welcome to one and all. I'm wishing you all a very fruitful time with a deep learning and interactive session for an enriching experience. And welcome you all once again. I remind, thank you.
Thank you, Father. Today, we observe an international webinar on organ donation and transplantation. I'm extremely happy to introduce and welcome Dr. James Walker, Honorary Professor of Medicine, University of Birmingham, the National Advisor Group, Consultant Physician, Liver Unit UK. On behalf of Sancha College, I extend a warm and cordial welcome.
Whew, thank you very much indeed, Father. It really is a pleasure and honor to be asked, and I'm delighted. So thank you so much. I've visited India on many occasions, traveled around all parts of that huge country, and been enormously impressed by the vitality, the excitement, the joy, the noise, the smells, the food. It really is a great place, and I think more than anything, each time I go there, huge changes. It's a very exciting place. I have a lot of friends from India. We have a lot of colleagues in India. I visited transplant units and have a lot of fond memories. And I'm only sorry that I can't be physically there today. But thank you very much indeed for the invitation. I thought I would talk. I've had a lot of experience of transplantation and organ donation. And one of the things I'd like to focus on particularly are some of the ethical and moral dilemmas that organ donation and transplantation poses. I'm afraid, like most clinicians, I'm totally dependent on PowerPoint, and I hope I won't bore you. I'll try and be a little bit controversial just to get things going, and do please interrupt if I'm not clear, if I don't understand or you disagree. So we'll get underway, and again, thank you very much for the invitation. If I can have the next slide, please. Could we have the next slide, please? Yes. Sorry, if you just go back, the last one. I mean, transplantation goes back a very long way. The slide we just passed over, sorry, if you could just go back to the previous slide. This shows the early transplants was St. Cosmo and St. Damien, who were Syrian physicians around 300 AD, who transplanted the leg of an Ethiopian onto the body of another. And as you can see, the donor was black, the recipient was white. And as far as we know, the operation went well. Next slide, please. Equally, Ganesh, as you know, and I feel somewhat embarrassed about telling you the story, you'll know it better than I do. But again, Ganesh was another example, and perhaps the first example of successful xenotransplant, when the head of an elephant was successfully transplanted onto the body of an individual. So that goes back in time. But if we move forward now on the next slide, please. This just shows how transplantation has developed over really in the last 100 years. Probably the first successful transplant of humans was in 1905, which was an what we call an eye transplant, which is in fact corneal transplant. And that was followed by a uterus transplant. And then in 1950, when we really come to the modern era, when we had the first successful kidney transplant, and that was followed by pancreas, liver, heart, lung, and other organs. We've had hand transplants, we've had face transplants, we've had eye transplants, we've had intestine transplants. And so this has now grown, and transplantation has gone from an experimental technique to a routine technique. And the most organs that are transplanted are kidneys, livers, heart, lung, intestine, that's a small bowel, and pancreas. And as Father mentioned, we are now moving into the era of xenotransplants. The first transplants from animal organs to humans was done about in, I think, the 1970s or 1980s, when a baboon liver was transplanted into a human. It lived, the recipient lived for a few days before dying. But as Father said, we've had the first pig heart transplant into a human done this year. The recipient lived for several months, but then sadly died. And we've just had a pig kidney transplanted into a brain dead recipient, because one of the issues of xenotransplants, which I'm not going to discuss further, is these are difficult organs, and perhaps we can discuss those more. Immune rejection is the main problem with xenotransplants, but this may be the way forward in the future. Next slide, please. So the main organs that are transplanted are shown on the left. On the right are other transplants that have been carried out successfully. Corneal transplants are quite common now. Technically, these are tissue grafts, but as I say, it's now become mainstream practice. Next slide, please. Now, there's no doubt that organ transplants save lives, improves the quality of lives, and at least kidney transplants, where the alternative is renal dialysis, they save money, whether it's for the providers, whether it's for the patients, it depends on the system, but they have major impact on improving the quality and length of life. The challenges with organ transplantation, compared with other forms of medical treatment and expensive surgical treatments, is that for transplants to occur, there must be organ donors. And the challenges arrive because there are too few donors to meet the need. So essentially, a life-saving procedure has to be rationed. And the rationing is not due to financial requirements, although that plays a part, but the shortage of donors gives rise to major problems, ethical issues, which are not just of medical concern, but of public concern as well. Next slide. Thank you. So organ donors can be either deceased or dead, as it were, or living donors. And for deceased donors, we have two types of donors. There's donation after brain death and donation after circulatory death. Now, donation after brain death are the so-called heart-beating donors, and these are people who have had usually a catastrophic brain injury. Their brain has died, and they are being kept alive by mechanical ventilation. The whole concept of brain death has now been, I think, fairly well established over the last 60 or 70 years. But it is difficult sometimes for families to understand the concept that the brain is dead and the person is being kept alive by artificial means, but the heart is still beating. Donation after circulatory death is basically a non-heart beating donor. This is somebody whose heart has stopped beating and donation then can take place. The challenge, of course, is that when the heart starts to fail, it stops pumping enough oxygenated blood to the organs, and the organs start to deteriorate. So if a transplant is going to be successful, then there has to be a very short time between the heart failing and the organs being retrieved. And this means that a lot of people who could donate are unable to, because the heart starts to fail over a period of hours or days. The organs get starved of oxygen, and therefore they won't work when transplanted to a recipient. So those are the two types of deceased organ donors, and we'll talk a bit more about that in a minute. And then we also have living donors. So these are people who are alive and obviously very healthy, and they decide to donate either a kidney or part of their liver to another person. They are usually related, and it's usually a kidney that's donated. Parents to children, occasionally children to parents. Rarely a friend to another friend. There are some people, it's what we call altruistic organ donors, who decide to give a kidney or part of their liver to somebody they don't know. And those are known as altruistic donors. We're seeing a few of them in the UK, they're not many. But the challenge is that if you're a living donor, there is a risk to your life. So for a kidney donor who gives one kidney, maybe 1 in 5,000 donors will die as a consequence of that donation. For livers, the risk is much higher. It's around 1 in 250 patients. So you're taking a healthy person, they're very well screened to make sure there's no medical or other problem. You're giving them an operation that they don't really require for their health, and you're subjecting them to the risk of potential death. So that again gives rise to challenges. It has to be a very carefully regulated situation and is open to abuse. And I will just show you some examples where it has been abused. So just to recap, organ donors are usually deceased, usually after brain death, but sometimes after circulatory death. Living donors, again, in India, for example, where deceased donation is sadly quite uncommon compared with many other countries. It's about 1 per million donors compared, say, with the UK, which is about 37, Spain is about 50. I'm always surprised when I look at the Indian roads that there aren't more donor deaths, but there you go. Next slide, please. So if you can just go back to the previous slide, sorry, which just appeared. So the donor shortage is the real problem. There are many more transplant candidates than there are donors. In the UK, for example, 1 in 7 of those who are listed for a liver, heart or lung transplant die or become too ill. And this excludes the many, many people who don't even get on a transplant list. And this gives rise to the ethical issues. Next slide, please. So India, unfortunately, has got very low rates of organ transplantation. On the left side is the kidney transplants, and on the right side is liver transplants, and the pale colours on both show the very low rates of transplantation in India, and that is because of the donor shortage. Next slide, please. The religious leaders, the views of all the world major faiths support organ donation. And in this regard, particularly the Catholic Church has been particularly proactive in supporting organ donation. Next slide, please. The popes over the years have shown that have supported transplantation, in particular Pope Pius XII and John Paul II stress that it is the responsibility of doctors to determine the exact moment of death, and there are very strict guidelines in every country where this occurs to make sure that the donor is dead. The tests are done by 2 independent people, and of course that the brainstem testing is done only after the team and the family have agreed that the patient is not going to survive. So it is the role of the doctors to decide death. The concept of brain death was supported by the Pontifical Academy of Sciences, which said a person is dead when there has been total and irreversible loss of all capacity for integrating and coordinating physical and mental functions of the body as a unit. So the brain is central, and when the brain has died, then death has occurred. The Church has decreed clearly that when death has been confirmed, donation of organs can commence, and they've stressed that organ donation after death is, and I quote, a noble and meritorious act and to be encouraged as an expression of generous solidarity, and however, it is not acceptable unless the donor has given consent. And we'll talk a bit about this later. And Pope John Paul II, who I know was on the organ donor register, said that the donation of organs is, if it's performed in an ethically acceptable way, it gives chance and health to people who have otherwise no hope. So the Church has been at the forefront of promoting organ donation, provided it's done in an acceptable form. Next slide, please. So, again, the current Pope, Pope Francis, has indeed further extolled the merits of organ donation, saying it should be encouraged as a manifestation of generous solidarity. You can read more of that if you wish, but the point I want to make is that the Catholic Church in particular, the leaders have been consistent in their support for organ donation and stressed that it has to be done in the proper way, properly controlled, respecting the rights of the donor. But the gift of life is so important. Next slide, please. So, one of the questions around organ donation is, should organ donors be reimbursed or awarded for their donation? Now, of course, if the organ donors are dead, you can't reward them directly, but you can reward the family. And are bodies and body parts, can they be considered as commodities? I think the answer to that is clear. Next slide, please. Organs, the body is special, and even after death, one has to treat the body with dignity and respect. But there is abuse, and when there is war and deprivation, then this will be abused. And this is a slide, I think, from one of the news feeds showing that in Afghanistan, when there was poverty, people were induced to give a kidney, and you can see a number of people there showing their scars of kidney donation when they were encouraged, coerced, or sometimes forced to donate their kidneys. Next slide, please. So as you can see, in Iran, where for a while kidney donation was financially reimbursed, this is a living kidney donor, they were given between $2,000 and $4,000. On the black market, the same kidney can be sold for up to $160,000. So the donor who takes all the risk will get a very small amount. The people who really make the money are the middlemen, and as you can see, the profits are enormous. We see this not just in Iran, not in Afghanistan, it's all around the world. And I heard that when the tsunami struck in India, for example, within days, middlemen were going to those fishermen who'd lost their boats, who'd lost their houses, who'd lost their livelihood, and often other members of the family, saying, look, you've got nothing now, you've got children to feed, the only thing you have to make money is you can sell a kidney. And people were desperate, yes, and many people did sell a kidney. Some died directly as a consequence, some developed problems for which they weren't supported, but they were so desperate. We also see that these black market kidneys are not properly assessed, and the recipients will often have infections transmitted with them, hepatitis B, hepatitis C, HIV, and other diseases. Another concern with organ donation is Falun Gong. In China, the Falun Gong have been abused by the Chinese authorities. It is alleged, although I have to say the Chinese government denies this. And the Falun Gong argue that members of the group are taken, they're killed, and their organs used for transplantation. I think that certainly used to be the case, the Chinese government saying it's cleaning up their act, but there is no doubt that Falun Gong members, sometimes executed prisoners, were also used as organ donors without their will, without their wishes being expressed. Next slide, please. So there was a large public outcry about organs from executed prisoners, as I've mentioned. And for a time, the Chinese were actually publishing the effects of, so what was happened, the prisoner was sentenced to execution, they were taken to the operating theatre, they were shot in the back of the head, and then in the theatre the organs were removed. Consent wasn't asked or given, and it was a major source of organ donors. Allegedly, this has now stopped. Next slide, please. So sometimes organ donation is taken against the wishes. Sometimes people are coerced into donation, but sometimes donation can be reimbursed. Now, in Iran, as I mentioned, for some time, the state organized the system, and the concept was that if the state did it, it would not be open to abuse. They would ensure that people who donated were properly assessed, properly consented, and nobody made a profit. Other countries, such as Spain, for example, they do encourage organ donation by supporting payment for repatriation or giving a contribution to funeral expenses. I have to stress in most countries, if not all, it is illegal to receive payments for organs, although sometimes additional expenses can be reimbursed. But again, that gives rise to major problems. If you say, for example, that a person is autonomous and has the right to decide what happens to their body, why shouldn't they donate? And if I need a kidney and I've got lots of money and you have got no money and are desperate, why shouldn't you sell your kidney? I think my own view is this is entirely wrong, but you can understand some of the arguments in favor of patient autonomy, saying, yes, my family is desperate, they've got no food, no source of income, and the only way I can look after my children to feed them is to sell one thing I have, which is a kidney. It's an unfortunate world, it is illegal, it is morally wrong, but at least I can understand that why people do it, and particularly why they're coerced into doing it, but it is appalling that they receive very little, and the people, the middlemen, are the ones who make the money. Equally, you can understand, I think, people who are dying, who will go to any length to try and get an organ. I'm not supporting it, but at least I think one can be sympathetic to the recipients, even if one deplores their actions. Next slide, please. After all, and finally, you can sell your hair. I just went online, interestingly, as you can see, I've got very little hair, so I can't sell mine. But you can sell your hair, and you can work out, if you go to these websites, how much you get for your hair. And if you can sell your hair, why shouldn't you sell other parts of your body? I put this in as a sort of partly a jokey slide. There are obvious differences, but I thought it might just sort of amuse you that you can sell your hair, at least if you're lucky enough to have some. Next slide, please. So, on the whole, in most countries, organs from deceased donors are considered a national resource. When they're given, they don't belong to the donor family, they don't belong to the hospital or the unit where the donation takes place. They are considered a national resource, and therefore organs must be allocated across the nation. The other concept that is widely accepted is that organ donation must be unconditional. And I'll give you an example which posed some problems in the UK several years ago. That's from deceased donors, whereas from living donors, the opposite occurs. They're usually directed. You say that I will give my kidney to my wife, or actually it's more common that the wife gives it to the husband, in fact, although occasionally altruistic donors occur. Next slide, please. Now, this is a case that occurred in the UK some years ago, and I think raises all sorts of challenges. This was a motorcyclist in Sheffield. He had signed up on the organ donor register. So he said in the event of his death, he wanted his organs to be used. And as sadly many motorcyclists do, he had a fatal accident, taken to hospital, failed to resuscitate, and he was declared brain dead. His family were approached and they said, we'd like to donate. And the family said, yes, we support donation, but the condition is that the heart was given to a white patient. Other organs we don't mind, but the heart has to go to a white patient. Now, this posed a problem for the coordinators. Next slide, please. Now, I take it as read that one completely abhors the mentality behind that conditional donation. It was appalling, and there's no other word for it. But the donor coordinator who met with the family has really one of three choices. They can either say, right, we're not going to accept this donation. We think it's appalling that you're making these conditions. So 7 or 8 people might die because you've refused the organs. The second option is to accept the organs, but you ignore the wishes of the family. So you give it to whoever next on the list. People survive, people live, but it's dishonest. Or do you accept the organs and follow the demands of the family, i.e. behave in an unethical way, or you're following unethical guidelines? Inevitably, as these issues arise, this has occurred about 3 a.m, and the donor coordinator, a relatively junior nurse, had to make this very difficult decision. And I'll leave you, if you're still listening and still awake, to think, what would you do in this situation? Reject the organs and let people die, be dishonest, or follow unacceptable principles of discrimination? Well, what happened is the nurse felt that the third option was the least bad option. There was a terrific, and the organ donation went ahead, patients survived, recipients did well, but there was a huge outcry, and the ministers got involved, and it was all very difficult. People were sacked, and it was made illegal to make conditional donation. Next slide, please. But of course, 1 year later, a child in Birmingham died of an asthmatic attack. She came into hospital, was brain dead, and the family agreed to donation. But the child's cousin was on the kidney transplant list in the UK. And the family were approached, and they agreed to donation, but they said, we'll agree to donation only if one of the two kidneys, can go to her cousin. So the coordinators thought, oh dear, we're not allowed to accept it, and went to the Department of Health, and ministers were approached. And I don't know if ministers in India are any different from those in the UK, but they said, oh no, this would be awful if we said no. So they agreed, which is quite different to what they had said only a year previously about organ donation had to be unconditional. So when I was at NHS Blood and Transplant, was faced to finding a solution to this. And the compromise we came up to was requested allocation. So we said donation had to be unconditional, but they could request allocation to a specific close family under certain conditions. So a compromise, you may think this was a sort of fudge. It was in a way, but was this the best solution? I think it was, but this was quite a challenge for me and for others to sort out about conditional donation. Next slide, please. So consent for organ donation, there are a number of approaches that different countries have used and at different times. One is mandated organ retrieval, that if you die in any situation where organ donation can occur, your organs are removed willy-nilly. The state will take over. In the same way, you don't have an option about paying tax. You don't have an option if the coroner says you need a post-mortem after you're dead. There's certain things where the state takes over, and that is mandated organ retrieval. Some countries used to have that, but I'm not sure this occurs now. Another approach is the opt-in, and this is where people have to indicate their wish to donate. They can either do that by signing the organ donor register or by telling their families, and only those who've agreed to donate will have organs removed if they become brain dead. A second option is the so-called opt-out or deemed consent, where every person is deemed to have agreed to organ donation unless they have specifically indicated their wishes to the contrary. Now, this is adopted in many countries. It's been adopted recently in the UK. But again, I would ask you, is this really acceptable? If you say, have any other procedure, your assumptions are not taken as read. If you want to have your appendix out to save your life, if you want to have a tooth out, you have to give your consent, and it's not taken as read. And if you're don't have the mental capacity to make your decision, somebody has to make that decision specifically for you. So is deemed consent ethically acceptable? I have supported deemed consent, but I do wonder about the principles underlying this and whether they really are sound and robust. A second issue is whether the family can override the decision. If I say I want to be an organ donor in the event of my death, I go on the organ donor register to confirm that. And if I'm dying, the patient family say no, what do? You can't, legally, you can override the family wishes, and that has been done on a couple of occasions I'm aware of, but mostly surgeons will follow the views of the family because they've already had a catastrophic death and grieving, and you don't want to add further to their misery, their sadness, their loss. But it does, it does pose problems as to whether the family should override the decision. Another practical reason, of course, is that when you have a potential donor, you want to know their medical history, you want to know if they might carry diseases, cancer, viral infections, or whatever. And so you need to get the background from the family, and you really want their collaboration. A problem that we sometimes have, and again, one case I was involved with, we had an elderly man who died and was going to become an organ donor. He was married, but he'd separated from his wife 30 years ago, but wasn't divorced. He'd been living with another woman for 20 years, and they also, by his wife, his legal wife, they had a son. The wife, who was, who'd separated 30 years before, said no to donation. The partner said yes to donation, and the son said yes to some of the organs. Now, the wife said, I'm still the legal partner, therefore my views are paramount. The partner said, no, we've been living together for 20 years. I'm in effect the wife, so my views should be taken. And the son said, I'm the only blood relative, so my view should be paramount. What do you decide? Well, again, think it through for yourselves, what you would decide if you had to make that decision. Who would you follow? The wife, the partner, the son? Legally, this is all determined for us in the UK. The wife was still legally the wife, and sadly her views prevailed. But again, another ethical challenge. It's good to discuss over a coffee in the evenings, but when it's 3 o'clock in the morning and people's lives literally are dependent on your decisions, it raises a fair number of questions. Next slide, please. So another question that comes out is, if you agree to donation in your lifetime, should you get priority should you need a transplant over those who don't? And 2 countries have adopted that sort of approach. So in Israel, if you register as a donor, it increases your priority if you were to need a transplant in the future. So if you if you support organ donation, you get priority if you receive it. Similarly, in Singapore, under their Human Organ Transplant Act, all Singaporeans and permanent residents over 21 are considered to be donors unless they opt out. And if they do decide to opt out, which they're free to do so, then they get much lower priority in getting an organ. So is it ethically acceptable to withhold transplantation for those who won't donate? I can see arguments on both sides. In the UK, whether you opt in or opt out, you still get the same priority. But again, an ethical challenge, and I think it's difficult to be sure that the course that we have taken is absolutely the right one. Next slide, please. So the final bit of this, and I appreciate, thank you for staying with me if you are, I appreciate that, is how you allocate organs. As I say, there's a shortage of organs, so not everybody who needs one will get one. So how do you decide who gets the organ? You can do it on several ways. You can say you give it to the sickest patient first. So your goal is really to reduce death on the waiting list. But you may get people who are very, very sick, and therefore they may die anyway because they're not well enough to withstand the operation. You may go on the basis of utility, which is the best outcome to keep the organ going for as long as possible. You can do it on the basis of benefit, the one who gets the greatest benefit from the organ. Equity, you say everybody has the same chance of getting a kidney or a liver, so whether you're 90 or 15, or you can say the British simple queuing system, first come, first served. And it's very difficult to decide if you have a child, say, or a young adult, would they have priority over an older person? Would somebody, say, a mother with 4 young children who's dying of organ failure, would she get priority over a 65-year-old who's had a good life, had a good innings? It's very difficult to decide a fair way which is most effective. And the final bit, next slide please, I want to share with you is, sorry, one other thing of course is, if people have self-induced disease, such as alcohol or obesity or illicit drug use, should they get the same right as a transplant for somebody who has it through no fault of their own? We had a lot of issues when a well-known footballer, George Best, who was an alcoholic, who had alcohol-related problems, as you can see, got a liver transplant, and people said that those with alcohol-induced liver disease shouldn't get priority because they'd brought it on themselves. So we see other people, so the 2 commonest causes of liver failure in this country, as indeed in India, is alcohol and obesity. Both of these are, if you like, partly self-induced. I think that's a very superficial view. But if you take an overdose, say, and get liver failure, should you have the same priority as somebody who has a genetic disorder? We take it very clearly that the cause of the failure should not be a factor, but the public have very different views on that. Next slide, please. So I'm going to finish up on a study we did several years ago where we asked the public for their opinion. And I'd like just to go through this slide with some detail. So I want you to imagine that you have got 8 people, all of whom are dying of liver disease. You've been given 1 liver, and you've got to decide who gets that liver. And we chose slightly extreme cases for this exercise. We chose a 68-year-old lady who was looking after her 92-year-old father at home. Now, if she dies, the father will have to go into a home, but she's old and there are a lot of younger people on the waiting list. The second one was at the other end of life, was a young 9-month-old child. He's going to die shortly. He's got other children. We don't know what the very long-term survival is of these children. They live 10, 15, 20 years, we know. But what happens after that? Does a young person have the same right or a greater right than an older person? We also, and these are all based on real cases, a 21-year-old woman who has got liver cancer. She's 8 months pregnant, and because the cancer is quite advanced, even if she gets transplanted, she'll only live 1 to 2 years. But if you transplant her, she'll have the child, may see her daughter grow up for her first birthday, but she's not going to live that long, and therefore the liver will die within a year compared with the other patients where it will live with, say, 20 or 30 years. Then we had a 17-year-old woman who'd taken an overdose of acetaminophen, of paracetamol, after a row. She didn't mean to kill herself, but she's developed liver failure, and if she doesn't get transplanted, she'll die. But she brought it on herself. We then had a man who was in prison, a 50-year-old. He was serving a long prison sentence for grievous bodily harm. He still was going back to prison, but he'd obviously sinned against society, but he was receiving his punishment. And does a prisoner have the same right to that liver as, say, a young lad or a middle-aged woman? We took somebody who had alcoholic liver disease. He'd drunk heavily since he was 18. He developed liver failure, but it was due to alcohol. We then had a young man living alone, unemployed. He's a single man. He gives nothing to society. Does he have the same right to receive a life-saving transplant as, say, the man who has got 3 young children? And then we took a woman who was using drugs in the 1970s, as so many people did. She got liver failure from hepatitis C. This was before it could be cured. She developed liver failure, but again, she had brought it on herself, if you will, simplistic view. So you have those 8 scenarios. You have, say, 1 liver organ. Who would you give it to and why? Next slide, please. So what we did is we took those and gave it to 1,000 members of the general public. We gave it to 200 primary care physicians or family doctors and 100 gastroenterologists. And as you can see, their views are all quite different. The ones who they would be least deserving, this is the data I've shown here. Again, the alcoholic people were very aggressive about and said no. Some were against giving it to the person who'd taken the paracetamol overdose. And as you can see, there's quite a variation, so that the public, the doctors, again, have different views. And clearly there's no one right answer, but it just shows how difficult it is to make decisions. These are not medical decisions primarily, these are ethical decisions, and therefore it's essential that the public, as well as the donor families, input into the rules governing organ allocation. We're coming to the end now, you'll be pleased to hear. Final slide, I think. Please. So, there's no doubt that organ donation and transplantation is a major success. It's an expensive procedure, but it does save lives and it transforms lives, not only for the person involved, but their family. The need for organ donation raises many medical and ethical issues. And I've outlined some of the problems of abuse of the system, of coercion, of dishonest and immoral practices. But I wanted to stress really that these ethical issues are not the prerogatives of the medical professionals, and the views of the donors, the donor families, the recipients, healthcare professionals, ethicists, and above all the public are really important, because if the public lose confidence in the organ donation allocation system, donations will fall, and it'll be to the detriment who need those life-saving procedures. And the final point I want to make is please consider whether organ donation is appropriate for you. It is an individual decision, and it is essential that it's got to be voluntary. But I would also stress that families where organ donation has occurred after loss have a real sense of pride, a real sense of integrity, that out of their disaster, out of their tragedy, has come life for several other people. And we know that donor families get great consolation from organ donation. So organ donation doesn't help just the recipients, it helps the donor families. So please consider that. And if you do think organ donation is right for you, then please let your family know. It is supported by all major religions and many minor religions as far as I know, but you've got to decide what's right for you. Please consider it. And if you do think organ donation is right, let your family know, so that in the unlikely event of your death, they will know what to do and will do the right thing for you. So thank you very much indeed for your attention. I hope it's been interesting to you. I hope it'll raise some thoughts and some controversies, and maybe make life a little bit more interesting for at least an hour or so. It certainly kept me interested and occupied. So thank you again for the invitation, and I'll happily address any questions if you have them. Thank you again.
Is bone can be possible to transplant permanently?
I beg pardon? Sorry, I missed that question.
Sir, is bone can be possible to transplant permanently?
To transplant permanently?
Yes.
No, transplant patients live long periods of life. The organs don't seem to last forever. And if you like, a kidney may last 15, 20 or 30 years, a liver may last slightly longer, a heart may be slightly less. But when you have a transplant, you have to take immune suppression for the rest of your life in most cases. So it's not a total cure, it's a swap. But I've looked after hundreds of transplant patients, and their lives and the lives of their families are transformed for the better. It makes a huge difference. We've had patients going up Mount Everest, we've had patients sailing across to America. It transforms their lives for the better.
Sir, is it possible to transplant two or more organs during the same surgical procedure?
Oh, you sometimes more than one organs are transplanted. So you may transplant a liver and a kidney. We've transplanted a heart, lung, and liver in the same patient. So you can do multiple transplants in the same patient, yeah.
Doctor, how many hours after brain death the transplanted organ be removed from the body?
After brain death, provided the heart is beating, there is no medical cause for urgency. Once brain death has been declared, you have to maintain the blood and oxygen supply to the organs so that they continue to function well. So there's no great urgency for the brain dead donors. The need for rapid urgency is when the heart stops beating, because you then have to take the organs, remove them, and put them on machines. You cool them, remove the blood, and cool them usually, or put them on machines to maintain their viability. So you have only about 30 minutes. So it's really quite a challenge. And that's why there are relatively few donations after the heart has stopped.
Sir, does organ change one's personality?
No, is the answer. You do read of cases. I remember one that hit the headlines in the UK of a woman who had a heart transplant and said she became a lad. But for me, I remember I had one lady who had a liver transplant, and she came in quite distressed after about 6 months, and she said she kept on having these nightmares of being involved in the road traffic collision that resulted in the death of the donor, and she felt she was in that collision and felt it was her person that had been transferred with the liver. But when I checked up on the donor had died of a bleed into the brain and no accident. So I think it's a myth that your personality is I mean, it is affected because you're having a major life-changing operation, but you don't get the characteristics of the donor transferred. I think it's interesting with hand transplants that does cause problems in the recipients because, if you have a liver or a kidney or a heart or lung, you don't see it when it's in. But when people have had a hand transplant, they see the hand of the donor, and it makes them wonder, where's it been? Who's, what has it done? What, and that causes many more psychological stresses for the recipient. But but there's no question that you don't get the donor characteristics, psychological characteristics being transferred. It's a lovely story, but it's sadly not true.
Okay.
Good morning, sir.
Morning.
Can I ask a question?
Please do.
Okay. What happens after I sign up to be an organ donor?
What happens in India, as far as I know, is similar to what happens in the UK. Once you sign up, nothing really happens. You may get a card to carry or something, an app to put on your phone, but nothing happens. And the way it's done is that were you to be in a situation where you're a potential donor, you have a catastrophic brain injury, for example, you're in hospital, the doctors or nurses will only consider organ donation, see if you're on the organ donor register or signed up to organ donation, once they have decided that further treatment is futile. So there has to be a very clear understanding that the treatment of the person is the prime goal. And only when you say, well, look, we know this is going nowhere, the patient's brain dead, only then will you check if if they're on the organ donor register. And that rule is very, very important. It's followed. If organ donation, if the person is brain dead and they've agreed to organ donation, then the family will be approached. Tests will be done to make sure that organ donation can be done safely for the recipient. There aren't, for example, cancers or infections that could be transmitted with the organ. So nothing happens once you signed up on the organ donor register, apart from the fact you feel good about yourself, I hope, and proud of yourself, until that such a time as organ donation is a potential way forward. It's worth saying as a sideline that in the UK, at least, I know the data, people on the organ donor register actually have a longer lifespan than those who are not on the organ donor register. So by signing up to organ donation, you may increase your life expectancy. But that's just a sideline.
Okay, thank you, sir, for your valuable information.
Doctor, do we need to take the body to a licensed multi-speciality hospital to donate an organ after brain death?
It depends on the country where you are. In the UK, we have a specialist organ donation retrieval team. So wherever you are in a hospital in the UK, your body is not taken anywhere. It is the removal of the organs is done in the hospital where the patient died. In some countries, they do move the potential donor to a place where the retrieval can take place. I don't like that terribly. I think you need to respect the body after death as before death, and moving the donor from one place to another is not ideal, but some countries do it. And again, if it supports the donor family and saves lives, I've got no objection to it. But I think most hospitals, and including I think those in India I've worked with in Delhi and Chennai and places, they will go to the hospital and retrieve the organ there rather than move the donor to the recipient. In the old days, the donor and the recipient were in the same place, but now retrieval is done in the hospital where the donor is being treated. So I hope that answers your question.
Yes, sir. Yes, sure.
Yeah, thanks.
Good morning, doctor. I have a question there in the chat box. I will read for you. Hi,
Please.
sir. I have this question for you. How is these organs are kept for long period of time after a person die?
Once once the organs are removed, until recently, they were put on ice, and so when the organs are removed, the blood is removed, and it is replaced with a special fluid, a preservation fluid, and the organ is kept cold until it is warmed up and implanted. And a liver can be kept for about 12 hours, and a kidney maybe for 24 hours, a heart for less. But now we have the use of perfusion machines. So instead of cooling the organ, it is put on a machine, kept at body temperature with blood, oxygenated blood being pumped through it. And that probably allows the organs to remain longer outside between the donor and the recipient. But usually we try and keep the interval between retrieval and implantation to less than 24 hours, because the organs do deteriorate and become less effective when for the recipient.
Thank you, doctor. Thank you very much.
We are highly obliged to express our very thankfulness to you for your very knowledgeable sharing efforts. We are honored and privileged to have you with us.
Thank you very much. It's been a pleasure. It really has, and a privilege for me too. So thank you for the invitation and for your questions.
Thank you. As we express our gratitude, we must never forget that the highest appreciation is not to utter words, but to live by them. I request Ms. Manjima Manuel to deliver the vote of thanks.
I deem it a great honor and privilege to propose the vote of thanks on this occasion. I would like to take this opportunity to place on record hearty thanks to our resource person, Dr. James Newberger, Honorary Professor of Medicine, University of Birmingham, the National Advisory Group Consultant Physician, Liver Unit UK, for the ocean of information he provided about organ donation and transplantation. Give yourself and those in need on the elixir of life by purging your organs. Transplants transform lives and reshapes future. Our most humble gratitude goes to our principal, Reverend Father Dr. Gijo James Indiparambil, Vice Principal Sister Josmi S.H., Bersal Father Jojo Adambakalel for their support. And also heartfelt thanks to IQAC Coordinator, Mr. Anuj Chako, for his guidance and support. And special thanks to Ms. Thomas Leswin for hosting this webinar. Lastly, I thank all the teachers and students who participated and made this webinar an effective one. Once again, I thank each and everyone for their active participation.
Thank you, Manjima. We always remember that organ donation is the noble deed and also a sacred act. To the world, you may be one person, but to one person, you may be the world. Become an organ donor. Thank you all.
Thank you. Thank you.